Joe, in a couple of weeks, we're going to do one of these with folks from Ohio State about back to campus. So
sounds great.
Yeah. Well, welcome everyone. Welcome back to Commissioners' Conversations regarding COVID-19. The topic of today is COVID-19 with our special guest, Franklin County Health Commissioner Joe Mazzola. I am Commissioner John O'Grady, and today is July 23rd, 2020. No, it is not Groundhog Day. Before we get started tonight, we should probably remind everyone, as we were discussing earlier, that we are doing this on Zoom, and so Joe's at home, I'm at home, Jamie, our signer, is at home. So we have kids, we have families. My dog is here, and so there's always a possibility of interruption. It doesn't happen, but no, something could happen. Doorbells could ring. My dog could decide that she is interested in something that's walking down the street. So if interruptions happen, we apologize in advance. But welcome. I'm the president of the Franklin County Board of Commissioners, and we started these conversations back in April to provide the residents of Franklin County with direct information that center around all the available aid during the outbreak, safety tips, and other useful information. We think these are important because of the numbers seemingly are getting worse by the day. When we began this back we had discovered the first case of coronavirus on March 9th in Ohio. Since then, there are more than 80,000 cases, more than 3,200 deaths in the state of Ohio at this point. In Franklin County, we continue to have the highest number of cases and the highest number of deaths in the state. We have nearly 15,000 cases as of today and almost 500 deaths. Today, the United States went over the 4 million mark in the number of cases. Unemployment claims have reached more than 1.5 million during this pandemic, which is more than Ohio saw in 2017, 18, and 19 combined. So today my guest is Franklin County Health Commissioner Joe Mazzola. This has been one busy week, and I wanted to get right into questions. So if you have questions, by the way, throughout the course of this program, go ahead and put them on Facebook Live, either on the Commissioner's page or on my page, and staff will go ahead and make sure that they get to us. So we'll answer them as we go. So if you're new to the series, that's how this happens. So let's begin. Commissioner Mazzola, normally what we do is I have our guests talk a little bit about their office and their position. I think over the last few months, folks have become pretty aware of Franklin County public health. But if you could elaborate a little bit on the work that your office has done over the last few months, and maybe start with the growing spike that we're seeing. When did the uptick start, and how is it different from what we experienced back in April?
Sure. Well, good evening, Commissioner O'Grady. Good to be with you again tonight. Thanks so much for having us. Really appreciate the opportunity. So, for Franklin County Public Health and our colleagues at Columbus Public Health, we combine provide public health services for the entire county. And what we have seen over the last 6 weeks or so is a significant rise in COVID-19 cases in our county, in our community. It really started right around mid-June. We started to see kind of that first uptick in cases. Before that, we had kind of peaked around early May and sort of slowly declined just a little bit. And then right around, again, about the June 10th, June 14th or so, we started to see that little uptick. And it has just gone further and further up as the last several weeks have gone by. So we are averaging, for our health jurisdiction, we're averaging right around 75 new cases per day. And just to put that in perspective, about 6 weeks ago, we were averaging about 25 new cases per day. And so collectively as a county, I think our 7-day rolling average is somewhere around 320 new cases per day or thereabouts. And so, we certainly are seeing a very concerning rise in the number of cases for our county. And really what we're seeing the same across the state, as you know. And so, we are certainly at a very critical point within the outbreak within our local community. We are seeing more and more cases of younger individuals. So our median age continues to decline. I think our median age right now is 41, whereas just a few weeks ago it was closer to 50. And so that continues to decline, which of course indicates to us that we're seeing more and more of our younger residents become COVID positive. So that's sort of the larger trend right now that we're seeing in Franklin County. We of course continue to every day work to respond to this outbreak here locally. We can kind of talk a little more about some of those strategies, but clearly what we're seeing is of concern. And I know that the Board of Commissioners and all of our elected officials continue to really raise the awareness of kind of that this pandemic has not gone away. And so we continue to be thankful for that. And we need to continue to look for more and more opportunities to make sure that our residents understand that this risk is as great today as it ever has been during the last 5 months.
So Joe, excuse me, on that note, is this a second wave, or is this a continuation of the first wave? How do you know the difference between the two?
So I think I'd characterize it sort of as a continuation of the first. And I say that because, when I just talked about how we sort of peaked in that early May, late April, early May, we never really got back to baseline, so to speak. It never really went down to a point where I would consider that first wave really ended. It was really just sort of a stalling, and now that wave sort of has continued on. So I don't think that I would characterize it as a second wave, though some may not. But really, I think what's important for our residents to know is that the virus never went away. Even during those late weeks in late May and into early June, we still had fairly significant community spread of the virus. So the threat never really went away, and that would indicate that it was under control. And that's kind of how I would define it, that the virus never was under control. So, we went into that period of late May, early June, thinking, it was sort of fairly steady, and then that uptick came. So I would characterize it as this kind of a continuation of that first wave. And for us, again, what we've been working so hard on is to really contain this virus in a way that we can see that steady decline that's, over time. And we just haven't seen it yet so far. And most communities, unfortunately, have not seen it across the state or across the country.
So there remains at the time confusion about testing. Drive-up testing is available in Franklin County. Is drive-up testing available for everyone, or do you need to go to request it from your doctor? Do you need to get an appointment for it? Talk about testing a little bit.
Yeah, so for testing, a couple of points that I want to really emphasize. The state of Ohio, about a month ago, maybe 6 weeks ago, changed their guidance to basically say, if you feel that you're at risk for COVID-19, you should go and make arrangements to get a test, whether you're symptomatic or not. And that was a big change. So over the last several weeks, we've been working really hard to increase our testing capacity here in Franklin County. Couple of things that we always want to highlight. If you feel you do need a test, always contact your primary care doctor first. Try to make arrangements through your primary care doctor first and foremost. If you don't have a primary care doctor, several resources are available. You can contact a community health center, federally qualified health center, and make arrangements to get tested through one of our many FQHCs in Franklin County. And then we also have other options. Of course, many of our pharmacies are offering testing. So think of those private pharmacies that you go to for various reasons for prescriptions and so forth. Many of them have testing options. Most of them do require an appointment, but they are available that you can do that online or over the phone. And then our colleagues at Columbus Public Health, in partnership with our 3 adult hospital systems, have made testing available at Columbus Public Health Monday through Friday. And I don't believe you need an appointment, but it's encouraged. So more information about testing is on our website, and we can maybe put a link to that in the chat box or through the comments section, because we know that testing is a vital strategy here. Again, kind of going back to what we were just talking about, in order to get this virus under control, first thing we have to do is have timely testing. And I know that there's been some frustrating pain points regarding the timeframes of getting those tests turned around. We've heard anything from 3 days to more than a week. Certainly, when you think about the disease progression, the timeliness of that test is critical, so that we can identify that case, and then we can start making sure that we're doing the appropriate follow-ups with any potential contacts. So we're going to continue to focus on testing. We are working on kind of a comprehensive testing strategy for Franklin County, working with our healthcare partners, working with our other community-based organizations and other private partners to make sure that we continue to increase our testing capacity, because we want to make sure that if anyone feels that they are at risk, that they go and get tested, and that they have the opportunity to get tested. So more and more opportunities every day, but certainly those would be a couple that I would highlight. Again, starting first and foremost with contacting your healthcare provider, and then looking for other community-based resources if you need some.
So some of the employees that you manage in your office are contact tracers. Can you explain what they do and how they've helped during the pandemic? Can you share a little bit about what they've discovered so far?
Sure. So yeah, a lot of discussion in the media and in sort of in the public domain about contact tracing. Let me first start by saying contact tracing is something that we've done in public health for decades and decades for other infectious diseases. It's a core basic public health function. So basically, contact tracing is once we identify a case, we have an extensive interview process with that individual, and we ask them various questions about who they may have come into contact with over the course of the last week or depending on the particular disease, there's timeframes involved. So when we go through that process, we identify who those particular individuals are, and then we start the contact tracing. So we start calling, emailing, in some cases texting those individuals to sort of verify the circumstances and to let them know that they may be at risk for a potential exposure to COVID-19. And so for us, we've been fortunate through some funding from the state of Ohio, we've been able to hire 23 public health investigators who are helping us with the extensive contact tracing that we've been required to do. Now that we have more than 3,700 cases, we have thousands of other individuals that we have to reach out to as part of that investigation. So we've been able to hire additional staff to help us with that. And I want to make sure that our residents know that if for whatever reason you have been identified as a potential contact of a confirmed case, please take a few minutes and talk to us at the health department. If you receive a phone call from your local health department, please take a few minutes and have that conversation. It's so important for us to be able to understand the circumstances, and then if necessary to ask that individual to quarantine themselves. That is really the only way, again, after the testing, the contact tracing is the only way we're going to continue to hopefully contain this outbreak in our community. So, we've heard that some individuals haven't been as receptive perhaps as we had hoped, but I would say overall, the vast majority of our residents have been extremely understanding and extremely cooperative in those conversations. We want to thank them for that. So if you do happen to get a phone call from the health department, please take it and talk to us about those circumstances. We need to have that information so that we can best advise those individuals as well for their own safety and for the safety of their friends and family. so that they are not potentially exposing others to the virus. So it really starts with those initial conversations with the confirmed case, and then the contact tracing of any of those individuals who may have come into contact with that individual.
So Joe, you and I, let's talk about masks for a little bit. You and I talk about masks all the time. I mean,
Sure.
I think you and I probably talked about anything more than we've talked about masks. Maybe lately we've talked about school, and hopefully we'll talk about school here in a little bit, back to school. But you and I have talked about masks quite a bit. Masks have become this highly politicized issue. It's all about politics these days. And so talk to us about, you know, and believe me, I don't believe that this should be a political issue at all. Masks are important, but why? Tell me why. Tell us all why, if you can, why doctors believe that masks can help.
Well, the bottom line is that they've been proven effective to slow the spread of the virus. You know, one of the main ways that the virus spreads is through droplets that are either, you know, when you're talking or coughing or sneezing, that the virus is able to get into the air, and then thus perhaps you know, to those individuals around them. And so that face covering is exactly the purpose that we want. We want to slow that spread. So wearing a face covering or a mask, it's all about protecting the other person who you are perhaps nearby. It's not necessarily about protecting yourself, but when you combine that, when you wear a face mask, Commissioner, and then I wear a face mask, now we're protecting ourselves in addition to that social distancing. And so we're layering on these protective strategies here. But it really starts with that idea that if you cover up your nose and your mouth, you're gonna absolutely slow the spread of the virus through that droplet-based transmission. Of course, there's other ways that the virus can spread, you know, on surfaces and so forth. But really, what we have learned over the course of this pandemic, and what the literature has demonstrated, and you know what others, the governor and others have said, this is not open for debate. Face coverings work, and they are effective. And so when 80% of us use that, we know that we can make a significant impact in reducing the number of cases. It's what it fundamentally comes down to. How do we slow the transmission of the virus? And that is a proven effective strategy. And so our medical providers obviously have been certainly talking to us about that. In public health, we've been talking about it. Our elected officials, of course, have been talking about it. And it absolutely should not be a political issue. I'm here to say that, you know, what we stress at Franklin County Public Health is that face coverings work. We have information on our website about why they work. We have information on our website about how to use them effectively, how to use them appropriately. But they are a necessary strategy that we've just come to learn over the course of this pandemic that truly will help us continue to stay at work, continue to be able to have some semblance of normalcy, you know, to go to the store, to go to, you know, out into the community. If we want to continue to do those things safely, you have to wear your face covering. It's exactly why we have required it. Our Board of Health has made it a requirement for our health jurisdiction. Of course, the city of Columbus has done the same, and of course, the state of Ohio as well. And so those actions have been taken because we know that ultimately they are going to save lives, because we are going to be able to slow the spread of this virus. So we cannot stress it enough how important it is.
Joe, is there a difference between a mask and a face covering?
Well, yeah, there is. I mean, if you look at a surgical mask as opposed to a cloth face covering, of course, it's made out of different materials and of course for different purposes. But fundamentally, for what we're talking about here this evening, we would advise to use either. They really they really are both effective. And so when we talk about face coverings or masks, I know a lot of people sort of use those words interchangeably. We certainly would advise that either one of them will work.
Okay, so cities and municipalities around Franklin County all have, or most of them have ordinances for for mask orders, and then Columbus or Franklin County and Columbus Public Health have mask orders, and the state of Ohio has a mask order. So which one should folks follow?
All of them.
Good answer.
So what I would say is, and I know it gets, I know it gets a little confusing, but what I have said is, they all are in alignment. Whether it's the state mandate, the Board of Health's requirement, local municipalities, they're all trying to accomplish the same thing. It's a requirement in our community to wear your face covering when you are out of your house. And so it really doesn't matter. And I know that might be, I think fundamentally, we just need to understand that in our community in Franklin County, we have to wear our face covering. And so it was important. It was important that our Board of Health took that action, because we don't know when the state requirement's going to go away. And we want to make sure we have that local ability to have that discussion. But, again, we have continued to educate our residents about why it's so important. And I have been so thankful to our residents and our community that they have taken this seriously and that they are wearing their face covering. And I cannot thank them enough for doing that, whether it's required because of the governor or by our local municipalities or by the county. The bottom line is that our residents have taken that, they understand it, and they have really taken the necessary steps out in the community. And I'm very grateful for that.
As my colleague Commissioner Boyce would say, in the immortal words of John O'Grady, Commissioner O'Grady, wear your damn mask.
That's right.
Just it doesn't matter where you are, or who you are. I mean, at this point, the businesses in Franklin County are enforcing it. If you try to go into a grocery store, you try to go to a big box store. A lot of these corporations and businesses, and if you try to go into, your office or wherever, folks are enforcing it. So, just wear your mask. It's where we are in this day and age. It's time to wear your mask, and we're gonna. So, and on that note, let's move into now another conversation and talk about school. I mean, we're trying to get to a point where we need to move the numbers in another direction. So, I noticed on the governor's press conference today that we only hit like 3 of his indicators, but at the same time we were still in a level red, and I'm assuming it's because of our number of cases. They're not going to move us back down the list because we haven't hit the indicator or a certain number of indicators when we have the number of cases that we have. But at the same time, we are, here we are heading towards back to school, in another few weeks, and parents are anxious, because I mean, frankly, at the end of the day, kids need to be in school. Parents need kids to be in school. Kids want to be in school. Both of my kids want to go back to school. Kids need to learn, and they learn better in the classroom. There's all kinds of, conversations we can have around this, but at the same time, that's an environment that's, a very difficult environment. We've all heard, all the conversations around this. So, as we move towards this, how can parents best get ready for and prepare their kids for school in the coming weeks?
Well, let me start off by first saying how difficult and challenging this circumstance is, and I would absolutely agree with everything you just said. We know that kids want to get back to school. We know that parents want to get their kids back to school safely. We understand that kids do better when they're in school, when they're not, as opposed to when they're not. But we've never faced something like this really in modern history before. So we've never had to have these conversations. So the first thing that I think parents can do is to stay engaged with their local schools in terms of this conversation. Franklin County Public Health has been actively engaged with all of our school districts across our health jurisdiction. And what we have said to our superintendents and to our boards of education is that we're going to give you the best public health guidance that we have at the time that we have it. But we also have told them that they need to know that things are going to change and evolve. And so a few weeks ago, we gave them guidance as they had been preparing their back to school plans. And we gave them guidance to suggest that, first and foremost, any student and any family, as they think about going back to school, if they're not ready to go back, they should be given that opportunity to go back and do online learning. And then we've also suggested to them that as we have, looked at the data for Franklin County, we have advised that again, this is 3 or 4 weeks ago, that they look at a blended learning model, a sort of a hybrid model to get as many kids into the classroom safely, but to do that in a way that would, perhaps give us more opportunity for social distancing, of course, wearing our face coverings, doing additional things in and around the schools to ensure that we are doing everything we can for a safe environment. Now, that was, again, 3 weeks ago. We've talked about earlier this hour about the trends that we have seen since then, the tripling of cases that we have seen in our community. So that has given us pause, and that has, again, sort of illustrated when we tell them things are going to change, and they're likely going to change between now and mid-August. So, as we continue to look at the data, we are going to have, again, continued dialogue with our school districts to make, again, the best public health recommendation that we can. Our goal at the health department is to make sure that we are putting the health and safety of our kids and our teachers and our administrative staff and everyone who supports our schools to make sure that we're doing everything we can for their health and safety first and foremost. Now, we don't know exactly what the new guidance may look like, but we're going to have active conversations with them. I know many of our health departments that are looking at this across the state and seeing these trends are looking at potentially making recommendations about online learning to start off the school year. That's something that we are looking at right now for our health jurisdiction. And I want to just say that our school districts, our superintendents, our boards of education, they have put in incredible time and effort to try and, again, bring our kids back to school in a way that's safe and back to school in a way that would allow for, the best opportunity for learning as we look at, into the fall. So we don't know where this is going to go in terms of, based on, again, if we continue to see the increases in cases that we've seen over the last 4 weeks, we're gonna find ourselves probably having to make a different recommendation. We're not quite there yet, but I want any family that's listening to this conversation that Franklin County Public Health is having very active dialogue with their superintendents, their boards of education, and others to make sure that we are making the most informed and up-to-date recommendation. So stay involved, stay engaged, and just be understanding in that things are likely to change between now and when the kids are supposed to go back to school in late August. So this is one of the most difficult parts of this has been trying to work through the back to school. We understand, and we've heard from the American Academy of Pediatrics, the health benefits. We absolutely support that. But the first and foremost is the immediate health and safety of our kids and those who support them in the classroom and at home. So we're going to keep that dialogue going, and we will make sure that we keep our community informed as that progresses.
Gotcha. So, Joe, what are some of your biggest concerns as we're heading back to school? What are the things that you're worried about? I mean, I know you're meeting with the superintendents. You're talking to them all the time. You're planning for this. They're planning for this. I'm hearing from teachers. I'm hearing from parents. I know what some of their concerns are, but what are some of the things that you're concerned about?
Well, like anything else with COVID-19, we're concerned about the opportunity for this virus to really take hold within a particular school building, a particular classroom, a particular school district. When we give the virus opportunity to spread, we just don't know exactly how that's going to look. So, we could have potential scenarios where we have entire classrooms that we have to exclude potentially for 2 weeks. We have potential scenarios where we may have, we may have a significant number of teachers potentially become positive because of the transmission that would happen in a classroom. We have scenarios where we could potentially have food service workers within a school building potentially. So the disruption factor, is certainly a concern. But of course, we know, and we've had conversations about how kids, from a mortality standpoint, seem to do better, and that is encouraging. But we also are concerned about the potential rate of transmission that they may be, that they become the vectors, so to speak, to transmit the virus to someone who may not have that positive outcome ultimately. Whether it's again, somebody within the building, whether it's a family member at risk who has a pre-existing condition or other medical condition. So the concern really at this point is that we just don't know how the virus is going to react when we open the buildings up to thousands of kids, and then it's not necessarily about the interaction between those particular kids. It's those kids who then interact with others, who then interact with others, and eventually, it's going to get to somebody who's not going to have a good outcome. And so, and again, but I also want to stress, we see kids who have been over the last couple of weeks, particularly through sports, who have tested positive, and we've had some complications with some of our younger kids with COVID. And so it's again, statistically, we know that they fare better, but the health risk is absolutely there for kids. And again, it's about how do we slow the transmission? How do we create the environment and the circumstances to ensure a safe return to school, both in the short term and the long term? So
Joe, and I want to remind the folks viewing to certainly send in their questions, and Joe and I'd be happy to answer whatever we can. But the other day, you're talking about the kid. You're just talking about kids and the way that they're reacting to this. The other day, I was on a call with state leaders, and one of the individuals indicated that as we were discussing back to school, indicated that kids under 18 really don't get COVID-19, and they don't it's been proven that they don't get COVID-19. And the Metropolitan County Commissioners that I was on a call with didn't react to that very well. So talk to me, if you will, please, about the differences between adults and children, and how this the difference between how easily the virus spreads amongst kids, and how that's how that reaction happens. Because we know that's not the case. We do know that kids can, one, get COVID-19, but two, more importantly, kids can spread it. And so talk about that, if you would.
Well, I think there is some misinformation about that, and I want to just read to you. Let me start with the statistics here for Franklin County. So for Franklin County, for ages 0 to 19, we have had 1,613 cases, 39 hospitalizations, and thankfully no deaths. So to say that kids under 19 don't get the virus is not true. And again, 1,600 cases out of almost 15,000. So a good percentage. So that's the first thing I would say. The second thing I would say is, obviously, and I think this is the science is clear on this, is that there are a lot of kids who potentially are asymptomatic. So they're not expressing symptoms. So they may have the virus and not even know it. And so the younger you are, the more likely you are to be an asymptomatic carrier. So that is really the concern. That yes, they absolutely can get the virus, and yes, absolutely they can spread the virus unknowingly. So our colleagues at Nationwide Children's Hospital have been very clear about this. Public Health has been very clear about this, and so I would encourage anyone who has questions about how the virus may affect their child to again reach out to their child's pediatrician. Many children who have pre-existing conditions, who have health conditions, pre-existing health conditions, should particularly pay attention to this and absolutely reach out to their pediatrician as they're making some of these decisions going back to school. I know I was listening to the CDC director just a few days ago. He was talking about his grandchildren, and one of them has cystic fibrosis. So that might be, certainly not a situation that most families can relate to, thankfully, but certainly whether it's cystic fibrosis or asthma or diabetes or other underlying health conditions, we know that puts kids particularly at a more significant risk as well, just like older adults. So it's certainly clear that kids are at risk for transmitting the virus, certainly at risk for testing positive for COVID-19. And what we don't know is how this is going to sort of play out when we do go back to school in whatever setting that is. And so that's why we want to err on the side of caution first before we make decisions and recommendations that potentially could, give opportunity for this virus to spread even more than it already has.
So Joe, when nursing homes had spikes, health departments began reporting details by nursing homes so that families were aware. Is there anything planned like that for schools? Will parents have any way of knowing that their kids have peers in schools that have tested positive? We do that in county government. I mean, we let folks know that they've got coworkers within county government who have been sick.
Sure. So and we are developing some infographics and some communication tools to provide our school districts so that they can use those to inform families and staff if and when they do have a positive case in their school building. But certainly any potential student who may have been exposed to the virus in terms of a fellow student or teacher or whatever, they will be notified. Any close contact will be notified. That's something we do all the time with schools. I think of pertussis as a really common example. But it's something that absolutely, if your child was in a classroom and with another student that may have tested positive, that family will be notified appropriately. We
Sure.
always ensure confidentiality and protect the health information when we're making those notifications. But certainly anyone who needs to know, who has a need to know that information as far as their potential risk of exposure, will be notified by the health department and by the school.
Thank you. Good. Well, a couple of notes from some viewers. Christy Columbus wants to let us know that she wants the kids to be in school, and she also wishes that there were boarding schools here in Central Ohio. So we don't have any of those. We do have some fantastic schools here in Central Ohio, but we do not have any boarding schools. And then a viewer asks, what advice can you give parents who are concerned about sending their children today as there continues to be a rise in cases? So they are considering sending their children now, but the cases continue to rise. So what advice can we give?
Well, again, I think what I would say is to make sure that you have all the information from your school as to the options and their their back to school plan so that you can make the best informed decision as a family. I know many, again, we've encouraged that they all provide online opportunities for any family that's not ready to go back to school, and to provide opportunities for parents to make decisions as the school year progresses. I know that some are sort of structuring their back to school plans in a way that would suggest that you have to make a decision now that might carry through the year. We've been asking our school districts to be flexible on that as much as they can be. Understand the logistics of those kinds of decisions could be disruptive in terms of how classrooms are organized, et cetera. But again, I think, my best advice is to make sure that you understand what those options are and to ask questions of your school district. It's been my experience that they are doing everything they can to provide the most up-to-date information about their back-to-school plans, and have been extremely responsive to their parents and families that they serve. And so I would absolutely encourage them to reach out to their local school district, ask the questions. There's information on our website as well. And so just get as much information as you can to make the best decision that you can. But again, I would go back to the fact that things are likely to change. I really want to stress that things really are likely to change between now and then. I don't know how. I can't predict how this is going to go. Hopefully, we continue we get back on track and we go in the direction that we want to go in, and we can get all of our kids back into the classroom sooner than later. But things could go in a direction that would require us to make some different decisions. So I would just again stress to our families, our parents, and to our students to understand that the circumstances are likely going to change over the next couple of weeks and into
Joe, that's exactly right, Joe. You and I were having this conversation yesterday, and I had this conversation with my wife just earlier today. Things are likely to change. I think you make the best decision you can make for your children today, and parents are going to have to be a little fluid, a little flexible, and school districts are going to have to be a little fluid and a little flexible. And I think they understand that. I think parents are going to have to understand that. Everybody's going to have to understand that. The other thing that parents are going to have to understand more than anything, we talk about this all the time. Schools, teachers, school districts, school administrators, everybody talks about this all the time. There's a serious need in this country, in this community, in this county for parents to be more involved in their kids' educations. Never more so than now. Back in the spring, everybody laughed about and joked about and complained about teaching from home and the fact that, parents really struggled with the whole idea that they had to teach from home. Well, it's a little bit of the new normal right now, and it's going to be that way for this school year and maybe beyond for a while. And so more so than ever, in every community, across every school district, across every socioeconomic, every socioeconomic border, we're all going to have to do a better job of being involved in our kids' education. And it's just going to have to be that way, because at the end of the day, our kids aren't going to be in the classroom as much as they were before. Our kids are going to be learning online more than they ever were before. Our kids aren't going to be involved in extracurriculars as much as they were before. And that's something I want to talk about here next. And it's just going to be different for our children. And we have to step up as parents, whether we live in, the city, or we live in the suburbs, or wherever we are. All parents need to step up a little bit, and it's just the way it's going to have to be. So anyway, and oh, by the way, that is true. My wife just reminded me, I'm not a very tech savvy guy. A lot of parents aren't, and kids these days, some kids are blessed with, having the access to technology, and others aren't. Folks, governments are trying to help step up. School districts are trying to help step up. So we're going to have to do better there as well. And so there's just a whole new world these days. So, you know, and there's we just got a note from one of our viewers that we're also going to have to address daycare. There's no question about that. And I know Franklin County is doing all that we can to be able to address daycare during this time, because parents are going to be faced with that and have been faced with that. So Joe, let's move into a similar topic as it relates to our kids and sports. Sports in school. You and I have talked about this many times. I know you've been on the sports committee as it relates to bringing the economy back, but also as it relates to heading into the school year. What can parents do to protect their kids as they head into sports? You and I have talked about this a bunch. My daughter's a crazy avid softball player. She just walked through the room. She's got her volleyball knee pads on. She's anxiously looking to try out for volleyball this season. So what can parents do, not just me, but all parents do to get their kids ready and protect them for sports as this coming school year, as this school year approaches?
Mm-hmm. So I would say that, with sports, the first thing I would advise is to become very familiar with the state guidelines for your particular sport. As you mentioned, I've had the opportunity to serve on a couple of different advisory committees to inform some of those guidelines. And I know that the state worked really hard to try to put together what they thought were the best recommendations, both from public health, some of our sports subject matter experts, those who run leagues, those who do this as part of their full-time job, and really those who understand how sports work from an operational standpoint. So become familiar with those guidelines and adhere to them. The guidelines are there to do our best, again, not to eliminate the risk, because we can't do that, but to really minimize the risk. If you as a family make a choice to say we're gonna try out again for softball or volleyball or whatever sport that you might want to have, follow those guidelines, because a lot of thought and effort went into those, and they may seem cumbersome, they may seem a little kind of onerous, and they may seem a little impractical, but to the best of your ability, try to live up to the spirit of those guidelines and to really apply them as best you can. That is going to be your best opportunity to keep your athletes safe and your family safe. Again, that'll look a little differently between the non-contact and the contact sports. I have obviously more concerns about those contact sports than maybe those non-contact sports. But either way, when you're gathering again as a team, when you're getting kids together, that's always an opportunity for that, for the virus to potentially spread. So take all the precautions that are there. And I would, again, ask all those individuals who run sports leagues or run organizations that sort of manage that. They have, from what I hear, they have really taken very seriously the guidelines. They've tried their best to implement them. I want to thank them for that. But again, these are guidelines to help keep everybody safe. And so it may seem, kind of, unnatural. It may seem like, oh, I've got to put a face covering on while I'm, in the dugout, or whatever the example might be. It's there to protect everyone's health. And, this isn't going to be permanent, but this is, again, an unfortunate reality of kind of the circumstances that we have right now. And so we want to get back on the field. Just like if we want to get back to work, we have to take these precautions. We have to be able to accept the fact that we have to do things a little bit differently, not forever, but for a little while, to make sure that we're able to return to play safely. So I think that would be my biggest advice, is to really just stay with those guidelines. Don't dismiss them. Try your best to adhere to them. And then if you see something that's not right, maybe make a recommendation to your coach or to the athletic director, and we can always hopefully advocate for changes that might be even more helpful. So there is a lot of information there. There's been a lot of guidance out there. And so all that information is also on our website. If you're having trouble finding it, we can put a link within the comments section as well.
Yeah, it is. It's
lots of good information.
It's in the comment section.
Great.
Mitch
Awesome.
Mitch Herville wants to know if Franklin County Public Health has been in contact with the Ohio High School Athletic Association.
So not directly, we haven't been, but we have been certainly through our school districts and the athletic directors with our school districts, kind of getting information through them. So I haven't been directly in contact with the Ohio High School Athletic Association. I know that they've been on various committees and so forth and have been very engaged as they look at the fall sports in particular. But they've been a good partner as far as making sure that they're doing everything they can to engage, coaches and so forth. But we have not had any direct contact with them. But certainly, if there's ever an opportunity for us, we absolutely be happy to be a part of any conversation that might be helpful.
So Joe, let's change topics here for a bit because we're starting to run towards time. We got about 9 minutes left, and we got to get through some stuff here. So the Franklin County Board of Commissioners and the Franklin County Public Health Department both declared racism a public health crisis, and these disparities run all the way back to America's early days. This is a 400-year issue that's been documented, and I mean, this country was basically built to make folks who look like you and I succeed, and folks who don't look like you and I have been put in a position to not succeed. But of course, on top of that, COVID-19, really highlights these disparities, and then it, on top of that, it highlights how big of a problem systemic racism continues to be. What has COVID-19 shown you about these disparities?
Well, we see them every day. We see them in the rates of hospitalizations. We see them in the rates or the numbers of deaths that we've seen due to COVID-19. The disproportionate impact that it has had on African Americans and other communities of color. So it's right there in front of us. It has shined another spotlight on these health disparities that we have known about for years and years, and we've been working on to try to address. And so, but to your point, Commissioner, we know that there are long-standing systemic policies and practices and systems that have contributed to the underlying health conditions that our community faces. And so COVID is just the latest example. And it has certainly, again, sort of reinforced why we need to declare and have declared racism a public health crisis, both public health, Franklin County Public Health, Franklin County Board of Commissioners, and others. And so that is really for us what was an important first step. And to do that in the middle of the pandemic, really, we couldn't have thought of a more appropriate time because we're seeing it right in front of us every day. And so we've been working really hard to engage the community across Franklin County to make sure that those who are most at risk are getting the information that they need, that are getting the resources that they need, whether it's testing, whether it's other things like a face covering, like we talked about earlier. We need to do more to make sure that those who are most at risk have the resources and information that they need to make sure that they keep themselves and their families safe. Yes, this declaration, certainly was a significant step as we continue as a county to address systemic racism, and we're going to continue to be a partner in that regard.
Yeah, we've seen it in the work that we've been doing over the years, and certainly seen it in the work that we've done over the last couple of years. And so it was, crucial that we definitely needed to declare racism public health crisis at the time we did as well. And so, have you noticed, by the way, have you had requests or have other health departments around the state or around the country reached out to you since your declaration with an interest to replicate what you guys have done?
We have. We've had several from across the state of Ohio. And I want to say that I'm part of the Association of Ohio Health Commissioners, the 113 health commissioners across the state. We have formed a work group about this so that we can advise and inform more local health departments to take on a similar declaration in their community. But ever since our declaration and yours at the Board of Commissioners, we have had a good handful of health departments reach out and ask us, what was the process? How did that come to be? What's our intention moving forward? Questions about our actual resolution, which has 17 action steps that we're going to start to take. And so it's been, very, for us, we've been really proud to be able to have those conversations. Our Board of Health, and all the credit to them that they have taken this on and, shown that leadership. And, for us, we've been fortunate to have several conversations with our colleagues, and we hope to inform a statewide discussion as well. So it's been certainly from that vantage point a great experience to be able to kind of inform that conversation.
So yeah, we had the same reaction. We had every metropolitan county in Ohio, along with the cities, city of Columbus, and all the urban cities, and not even just the urban cities. We had cities throughout the state of Ohio, Lima, Zanesville, cities throughout Newark, cities all throughout Ohio declared racism a public health crisis. But then we also presented to the larger Urban County Caucus of NACO, the National Association of Counties. And so counties throughout the country have, because of what we did, counties throughout the country have declared racism a public health crisis as a result of our declaration. Hennepin County, Minnesota, which is Minneapolis, Mecklenburg County, Charlotte, throughout dozens throughout the country. And Cook County, Illinois, and Franklin County sponsored a resolution to the Board of Directors of NACO, National Association of Counties. And so the National Association of Counties did a resolution demanding Congress declare racism a public health crisis. Now we'll see what Congress does as a result. But so it's something that's moved quite a bit. Okay, last couple questions, then we got to move on because we're about out of time. Do we have any hotspots here in Franklin County with COVID-19?
So in our health jurisdiction, again, we serve the townships, villages, and 14 cities in and around Franklin County, outside of Columbus and Worthington. We are seeing more cases on the eastern edge of our county. So in the Reynoldsburg area, Truro Township, Mifflin Township, Whitehall. And we just yesterday updated, we have a map on our website which outlines the number of cases by zip code to give our residents a better understanding of kind of what that the number of cases look like. And we just updated it so that you can see what the actual number is for each zip code. So we had a color coding to kind of help, sort of illustrate that, but now you can look and see how many cases are in each particular zip code. Again, for our health jurisdiction, it's not inclusive of zip codes that cross potentially, one of our cities that we serve within the city of Columbus. It's just cases that we have in our health jurisdiction, but it'll give residents a really good understanding of kind of what those hotspots are, and kind of where those, the numbers break down across our county and our health jurisdiction. But again, certainly a little bit more on the eastern part of the county as opposed to other parts of our community.
Gotcha. Okay. All right. There's a couple of questions that came in that I want to mention, and then I need to wrap up because we're running out of time. I'm continually being handed questions here. So, are there any reforms happening in health policies beyond the declaration?
I'm sorry, Commissioner, are there what?
are there any reforms happening in health policies beyond the declaration? And maybe we can mention the steps or put them in the link in the comments if necessary.
Well, we're always looking at policy change as a tool for us in public health, and so that's one thing that's in our strategic plan as a health department, is looking at policy change, particularly as it relates to social determinants of health. I would maybe provide a couple of links to those in the comment section. But policy change for us is a vital strategy, and we're always looking at evidence-based policies to help improve the health of our community.
Okay, and then this one I think is providing a way to link to your website, which is myfcph.org. And the question is what is the best way to stay connected to the progression of the approaches regarding the public health crisis issue? So I'm assuming the best way to do that is to go to your website, correct?
It is the best way. So myfcph.org, and then we have a scrolling feature you'll see COVID-19 as soon as you log into myfcph.org. Click on that. It'll take you to a whole separate website just for COVID-19, and it'll include things like resources, that testing information we talked about, the daily EPI report that we post every day, and a whole host of more information as well. It's the best way to stay up to date. We continue to post information online, of course, and of course on our social media channels as well.
All right, so it's beyond time for me to wrap up now. So there's, I'm sure, a couple questions I didn't get to. First, let me thank Jamie, our signer. Jamie, thank you as well. Sorry if we were too tough to keep up with. So you can find a lot of this information online on our website, commissioners.franklincountyohio.gov, or on the Public Health Department's website, which we've mentioned a couple times, which is myfcph.org. We'll continue hosting these commissioners' conversations. We had a little break there because we were working out some technical difficulties over the course of the last month or so. We had issues that were going on and things that were happening, but we took a little break, but we're back. We're going to do these things about once a week, unless something comes up, and we'll have another one on next Thursday. We're going to bring back some restaurateurs next Thursday. We'll have a little presentation with some folks from Dempsey's downtown, from Hales Ales in Mill Run, and from Lifestyle Cafe down in Old Town East. So we will be with them next week. And we'll always post this information on our social media channels, Facebook, Twitter, Instagram, and Nextdoor. And so I have another, like I said, I have another one next week, which is going to be about the effects on the food industry. My colleague Kevin Boyce has a chat on Facebook at 3 p.m. on Wednesday, dealing with the census and some societal issues. Of course, we want to reach as many of our residents as possible. So if you're talking to friends and neighbors, tell them that we'll be streaming conversations like these on a regular basis and posting them to YouTube. So until next time, I am John O'Grady, President of the Franklin County Board of Commissioners. And along with me tonight was Franklin County Health Commissioner Joe Mazzola. Joe, you got off the hook. I didn't make you talk about which restaurants that you're frequenting during the with takeout during the pandemic. But I want to say thank you for joining us tonight. And it was hopefully we gave you some useful and helpful information. Remember to mask up, wear your damn mask, Franklin County. Mask up, wash your hands, stay safe and healthy, and remember we're all in this together. Thank you, Joe.
Thank you, Commissioner. Thanks so much for the opportunity.
Appreciate it. Take care, everybody. Thank you, Jamie.